Hi, my name is Dr. Rudraman, and through the Oral Health channel, today we're going to be talking about what to expect once you've got your wisdom tooth surgery done. So wisdom tooth surgery is a very run-in-the-mill OPD procedure that is done for impacted teeth or decayed third molars which need to be removed, as third molars are usually not function in today's day and age. It's like the appendix, so it's not going to be much of use. So if you've gotten the extraction done of the third molar, this episode is exactly for you. The extractions can be either non-surgical, which usually are very atraumatic and that will not have any problem apart from slight pain and discomfort for the next 2 to 3 days. We hope that the doctor has given you painkillers and or antibiotics if required. Secondly, if the the extraction was surgical, that means there was a surgical field that was opened after opening the gums and the bone was guttered and the tooth might have been broken down into pieces and retrieved, and then stitches must have been placed back. There's a high likely chance you are bound to expect swelling, pain, discomfort for the next 5 to 7 days. Usually by 7th day the discomfort goes, the swelling also goes by 7th day, and the pain also goes much down. It can go up to 11 days, to be very honest, depending upon the severity of the surgery. You are also expected to have some sort of limited mouth opening because of the surgical field and the stitches. So don't worry about that because it's not going to cause you much harm. But once the stitches are opened after 10 to 15 days, you can open your mouth gradually with the help of exercises that your dentist can tell you. Otherwise, you can take some skeletal muscle relaxants that are required. I have already placed a video before about trismus, that is lockjaw or restricted mouth opening after wisdom tooth surgery. Also, if you are having bleeding for the next 2 days immediately after your extraction, don't worry, that's very common. But if it continues after 5 days, please call the dental office. For a DIY solution, what you can do is you can take an empty or a dry tea bag, right, with the tea leaves, and just place it right in your socket so that it can basically, it has tannins, so that will help in stopping the bleeding temporarily. But I would suggest that you call the dental office if the bleeding doesn't stop. Secondly, in some cases, unfortunately, you can expect some sort of paresthesia, which is a tingling sensation that you can get around the inferior alveolar nerve, that is about 5%, and lingual nerve, that is about 2%. But if you extrapolate the numbers, the absolute numbers of extractions that are happening on a daily basis, the number is not less. So that usually lasts for about 4-5 days. We can give you medications. It can last up to 45 days, and in some cases it has been reported to be till 6 months, but usually it is transient and you don't need to worry about it. You might feel something, and there's not much to be worried about an impacted tooth or its extraction or its the bone guttering, the swelling, everything. Within short 15 days you are most likely to get relief from everything, and you can go back to your regular life, your regular profile and all those things. So that's it for today. Please like, share, subscribe, and do press the bell icon for important updates. If you want to get in touch with me, this is my WhatsApp number and my social media handles. Kindly refrain from calling directly as I might be busy with patients. Just drop me a message and I can get back to you within a few days. At the same time, if you have any queries, doubts, apprehensions or suggestions, please feel free to put them in the YouTube comment section. So that's it for today.